Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls right here in studio at 866-870-5752, 866-870-5752. If you're just joining us, this program is about orthopedic pain or musculoskeletal pain, disc pain, back pain, knee pain, neck pain, etc. We are here Saturdays at 10 a.m., again at 1 p.m., and when you phone the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. So give us a call. I have lines open for you at 866-870-5752. And right now we're talking with Tony.
Tony, Dr. Marc Darrow, thank you for hanging on. You're still there with us?
Yes. Yes, sir. My pleasure.
Good, good. What kind of work is it that you do with gripping and twisting with your hands that's causing your wrist pain?
I build waterfalls and swimming pools like that. So I do plumbing and electrical conduit. It's the same gripping and twisting of fittings trying to go over onto pipes as you
Yep.
put them all together. Yeah.
Yep.
So,
boy, I'd like you to come and visit my backyard and fix me up. Maybe we could do a trade.
That sounds really good. You'd be surprised at some of the projects that we've done, and it's a really artistic expression to do something really natural and beautiful. You know,
I love it. I love it. I'm going to I'll give you a call later. We're going to get your phone number. I'll give you a call later tonight. I'd love to see your work.
Right.
Yeah.
Well, what do you
anyway,
think,
let's get back to your
tendon. Yeah, a tendon problem or a nerve thing. What do you,
I'm glad you're asking because I was just going to get to that.
Right.
Most wrist problems. I don't care if the bone is fractured or whatever it is. We get a lot of these things where the scaphoid or lunate bone have little cracks in them, and then hand surgeons want to put screws in them and things like that. Or believe it or not, they actually sometimes take these little bones out of the wrist. And I see those often. Patients come into me and it's a catastrophe. We can get most people better by just stimulating the ligaments to thicken up and tighten up. And usually it takes me about 2 seconds to examine a wrist to see if we can help them get better using platelets from their blood or using stem cells, okay? So wrists usually heal pretty well, pretty fast, pretty easily with a couple of treatments, sometimes one treatment. And I'm not promising anybody anything. I never do. And to make it even clearer, I don't treat disease. I don't do IV stem cells. I'm very focused just on the orthopedics, injecting into the ligaments, tendons, the joints, things of that nature. So it sounds to me like the ligaments in your wrist are stretched out, maybe some laxity from the overuse. Sometimes there's some arthritis that forms with it, and we usually can make people feel better with that just by stimulating the tissue growth in there. We use a teeny little needle. It's a 30-gauge needle to get in there. And we can use a cold spray to kind of numb the skin when we inject. So I think, actually, you know what? On my website, there is a video of me injecting a top tennis player years ago, and you can watch how I do it. The website is www.lastemcells.com, and I think you'll be able to find the video of me injecting the wrist there, or going to youtube.com and putting my name in there. And you can see how these injections are done.
Yeah, I'd love to try it because it's been quite some time. I just can't seem to heal. And I'm really overall in pretty good shape. I'm fairly healthy. I walk a lot, and I go through my daily routine. I can't do much with my hands because of the pain in my wrist.
Well, there's good hope ahead. I was the same way after I injured my wrist, and it was so painful. I can remember, and this is like 22 years ago. It would hurt if I would pick up a pencil. It was so miserable, and I haven't had any wrist pain since then. I'm in good shape. I'm going to go play golf today, which is pretty ballistic on the wrist, but I have no pain when I do. What's that?
What's your handicap?
Oh, very handicapped, yes.
All right.
No, I'm not a good golfer. I love it. I love it, but
I'm single digit, but I haven't played in a long time because of my wrist. So
well, come on in, and I'll take you up to Mountain Gate. That's where I'm going to play today. You've probably heard of it.
All right. Sounds good.
All right, man. God bless you. I appreciate your call, and there's good hope with you healing.
Thanks for your call, Tony.
Thank you.
What a good guy, huh?
Oh, absolutely. So you guys have all kinds of things in common. You're going to be best friends. He's going to
Yeah, we are.
He's going to fix your yard. You're going to fix his wrist.
I'll
You're going to go golfing together after all
together.
that. Yeah, it's fabulous. I love it.
Well, it's funny. My social life is basically my practice, my medical practice. I'm busy. I see people all day. I love visiting with my patients and getting them better. And all my patients have my cell number. So I get text all day, all night long. And as most people who listen to the show know, and my patients know, I answer emails day and night. First thing I do when I get up in the morning is I get to my computer, answer the emails, and I'm getting emails right now from the show, I'm guessing, because they're flying in. And then before I go to sleep at night, I'm answering emails. So I always love, even when I was a kid, I loved writing letters and getting mail. Isn't that funny?
No, I was the same way. I get it. I'm the same way.
I loved it. And so now it's switched to emails, and it's voluminous. And I love doing it. I love hearing from my patients and answering questions of people from all over the world. So for the moment, can I take a meniscus question?
Yeah, let me quick give the phone number while you pull up your question. It's 866-870-5752 right here at the station. You can call and speak live with Dr. Darrow. That's 866-870-5752. Lines are open. Go ahead.
Okay, so this is really typical. It's typical of me and all my patients. So, and I have a torn meniscus, by the way, okay? And I've injected it and made things better. But anyway, here's the question. It says, "Hi, I tore my meniscus in my left knee at the start of the pandemic. I've been walking and jumping on it
Oh, no.
with a lot of pain, but I'm determined. It's gotten in quotes better, but I'm still limping. And I have severe water on my knee." Guess who else had that?
Oh, that's hilarious.
Guess who else, Nita?
You do.
Well, not anymore, but yeah, I did.
Yeah, you had it. Yeah, I recall.
I had it. I walked. I can't say I walked. I limped off the golf course before we could use carts, during the pandemic thing.
Right.
And I literally limped to my car, and I drove down to my office, and I aspirated 35 cc's of fluid from my knee. Yeah.
Oh, my
I
God.
did. I actually injected it 4 times in that 1 week, and I'm fine. I just looked last week. I looked as I was doing someone else's knee with my ultrasound, and I had like maybe 2 cc's of fluid in it, which we call physiologic. It's not pathologic. It's healed. And I was like, wow, I am so grateful to be doing the work that I do for other people, because I can also do it on me. And when patients come in and they go, "How many years you been doing this? Do you think you'll ever retire?" And I go, "I will never retire, because I plan on being active, and I want access to all of the stuff that I do so I can inject myself. I don't want to have to go to another doctor I don't trust. I want to do it myself. So anyway, the person says, but I'm still limping and have severe water on my knee. That means their knee is swollen. And am determined not to have surgery, that's good, and not retreat to drugs. I'm very holistic. I wanted to see how much PRP or stem cell therapy I would have to do to fix it. I'm active and the pain is just frustrating. So that's the one thing we don't know. How many times do you have to do it to fix it? Nobody knows how healing will take place. I've had people with what we really do call bone-on-bone arthritis, where the bones really are connecting to each other and they can't move a joint, where I have done one treatment of stem cells and they've gotten some range of motion back. Not completely healed, but made them better and gotten rid of pain. And then I've had people where it looks like nothing is wrong at all and I can't seem to get them better. So healing is a strange bird. I don't understand how it works, and there are too many determinants of when people have pain and when they don't. Sometimes we have people come in and they've had an MRI on, let's say, their knee or some other area, and it's clean. It doesn't show any problems. It doesn't show meniscal tear. It doesn't show an ACL rupture. It doesn't show arthritis, and they can't walk. And I'm looking and I'm saying, I can't tell from the MRI what's going on, and let's treat it and see what happens. And we get them better. And then we have some people that have terrible arthritis and have no pain.
Interesting.
So it's hard to use what I'm going to call traditional or modern medicine to determine how much pain we have, where the pain is coming from, and what is going on. And I know it's very frustrating for patients who say, I want to know where my pain is coming from. I want you to fix that. And I say, what if I can't, quote, fix it, but I can fix you? And they get confused. Mm-hmm. And they go, but I want it fixed. And I go, well, you better go to an orthopedic surgeon and have them do a surgery and fix it. That doesn't mean you're going to feel better, though, because we have a lot of people who have had surgeries who have a fixed area, but their pain got worse. So it's tricky business.
It is.
It's very tricky. And we have to do a very good examination. We have to move the person around. We have to use our hands to find where the pain is coming from. Nita, I can hear you breathing, so I bet you want to go to Leah.
I do, Leah in La Habra. I sure do.
I can tell.
I know. I do that. I do that on purpose.
Leah, God bless you. It's Dr. Marc Darrow. How are you?
Fine.
How long, Leah, has your back I'm doing great, man. I'm living it up. How long has your low back bothered you for, Leah?
I guess it's been a while now, but all of a sudden it's gotten to the point where the pinched nerve, they took an MRI, the pinched nerve is going down from L4 and L5 down my lower back, down all the way down my right leg. Sciatica problem now because of it.
Okay. Do you have any pain in your back? It sounds like you do.
My lower back.
Yeah. Here's what can happen, and this is
the other day, but it sure hasn't done anything yet.
I'm sorry, you did what? You did what?
I got an epidural the other day, but
it
hasn't done anything.
That's good news. That's good news that the epidural didn't help, and I'm going to tell you why. When an epidural doesn't help, it typically means that you don't have a pinched nerve.
Oh. Really?
Yeah, I'm waiting for you to do the, really? So, yeah, I love when people come in, they said I had epidurals and they didn't work. It may just be a referral pattern from the ligaments in your low back. They can refer down all the way down the leg. I've had many, many people who have had arm pain, leg pain that we've fixed without epidurals by injecting the local pain in the area. They're called trigger points. And we can find the area sometimes and inject it. And it's usually the enthesis. The enthesis is an area where the muscle or the fascia or the ligaments or the tendons attach to the bone. So we can usually inject that area, and I have to do a good exam and touch the area and light it up. And we can inject that with your cells from your body, platelets from the blood, or stem cells, and fix that enthesis so it's not pathological anymore, and grow back the connection. And very often, the limb pain, the arm or leg pain, can go away. So before you get suckered into a surgery, which I hope you do not do.
I'm not having surgery.
Okay.
No way.
Then let's take a look at you and see if we can find the pain generator and heal it. Okay?
Okay. Because mine feels like electricity going down from my buttocks, as I call it, my right one, right in the middle, all the way down to my right ankle, to my big toe, like electricity. If I stand still. But if I'm walking around, I'm fine. But the minute you stand still is when you have so much pain.
Okay. Well, I'd have to check it out. I can't diagnose anybody over the radio. I haven't learned how to do that yet.
No, of course not. Okay.
If you do want to come to the office, the phone number there is 800-300-9300. I'm going to repeat it for everybody else. 800-300-9300. You can call there. There are people there now. If the phones are busy, leave your name and phone, and we'll get right back to you, and we'll figure this out, hopefully. You may be the person that needs surgery, but from what you're telling me, you're not that person.
I hope not. Okay, well, thank you so much.
God bless you. Thank you for calling, Leah.
Thank you, Leah. We appreciate your call. Our number is 866-870-5752 right here in the studio. And when you phone in today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. There are 264 scientific studies in the book, and the foreword is written by Suzanne Summers. And you can also go to Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. And you can email him off of every page on the site and watch those treatments on video performed by Dr. Darrow. All good stuff.
Hey, Nita, what happened to your neck? We haven't heard about you for a while.
Well, gosh, that was quite some time ago, maybe like 16 years ago, when you were doing the old-style proliferation therapy with pharmaceutical-grade sugar water. And I couldn't move my neck. The pain was going down to my shoulders. And I went to see you, and you said, okay, we're going to give you a shot a week for a while, see how it goes. I said, well, why don't you give me 4 shots today? Let's speed this up. So you gave me 4 shots on a Monday, and by Friday, I was pain-free.
Didn't you come back once, though? Didn't you have another injury? I can't remember.
So a couple years later, I re-injured the same way working out with my trainer. And
don't you love trainers? I love you guys.
I know, right? So, well, it's not her fault that because I try to push myself. But then I said, could I please have the same 4 shots in the same place?
How'd you do that time?
I was better in a week.
Well, you've been lucky. By the way, I don't mean to antagonize trainers. I think everybody should have a trainer, honestly.
Yeah.
It's a great way to motivate you to work out, and I've had trainers myself. One of the issues, though, that we see is oftentimes trainers will take people beyond their level of ability because they want to get them pumped up quick. So, if you have a trainer, I like that. But be careful to tell them to go easy on you. You're willing to go the slow way rather than the fast way.
Yeah,
and actually,
I
treat a lot of trainers because they're working out all the time too. So I'm going to go to, let me see, do we have anybody here? Let me go to a question that just came in. This is kind of complex, so let's see how much of this I can handle. I am a healthy and active 54-year-old woman, cholesterol about 220. That's no big deal at all. And by the way, cholesterol is not the cause of heart disease these days, so we can talk about that sometime. Okay. You can email me if you want to get more information about that. You know what it is, Nita? Carbs.
Interesting.
Yeah, when the insulin goes up, it's inflammatory, and then we get inflammation. This person says, I have several cervical, lumbar, and knee issues I manage with exercise, NSAIDs, that's like ibuprofen, and tramadol, which is a painkiller. That's not the way to do it. The way to do it is to fix it, honey. I would like stem cell therapy for my knee. On my last MRI, I have moderate to severe chondromalacia. That means the back of the patella is worn out and it's no longer fitting well in the trochlear groove in the femur. It's like a little groove that the bone in front of the knee slides in. And there's changes of the medial femoral condyle with near full thickness chondral loss. That means the cartilage is worn down there. And that particular spot in the medial femoral condyle, that's the end of the femur in the middle part, is very common to have a certain syndrome where the cartilage and the bone can literally break off. And then they say, basically, I'm missing a lot of cartilage. Yeah. Question. What will produce better results for me? Using mesenchymal stem cells and platelets derived from my bone marrow versus umbilical stem cells. Which one is better than the other? I understand that for the stem cell, I need to stop taking meds for several weeks and all the other caveats. Thank you in advance. So, good questions. There are doctors out there that say that the umbilical stem cells are dead, and that's all over the internet. You can read that. I have information from different stem cell companies showing that it is alive, and doctors like to fight with each other.
Just want to let you know we have Leon, and we're running out of time if you want to pick him up.
Okay, let's go to Leon, and maybe we'll answer some of this other question within his question. Leon, God bless you for calling. Dr. Marc Darrow, your knee is bothering you? How long has it bothered you for?
Just about started about a month ago, I guess. I called last week, and I got in on the tail end, and we didn't get a chance to finish our conversation. So,
wait, you called last week?
Yeah, I was your last caller, and we didn't get finished.
Oh, okay. Well, we only have a couple minutes, so let's get to this quick. Also, what you can do is you can go to my website. You can go to my website, www.lastemcells.com, and say that you were on the show and we didn't get time to talk, and I'll personally give you a call. But in the meantime, what was the diagnosis on your knee? What did they tell you?
I just went to my my general practitioner. She gave me a prescription that's in the ibuprofen family, I think, and that helps. Okay. But go check it and it comes right back. It seems like
Oops, sorry to interrupt.
Leon, I'm going to call you after the show, or maybe tonight, because I'm going to be running out to the golf course. But feel free to email me and from the website, and then we'll talk later today, okay? And I'll give you all that information.
Okay, thank you, everybody. We'll see you next time.
Thank you, Nita Valens.
Listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.